Hi, folks. I'm Scott Giles, a certified consulting hypnotist and a life coach. And every Saturday at 2:30 Central Time, I do a 10-minute video on some aspect of either coaching or the hypnotic arts and sciences. Today, I want to talk about what I've observed about cancer patients in my many years of working with them. In my practice, which is primarily a practice of medical hypnosis with life coaching added to help people find their new normal after a chronic diagnosis. In my practice, there are three areas of focus: oncology, cancer care; bariatrics, which is weight management; and fertility. So, over the next few weeks, I'm going to be talking about each of those areas, and today it's oncology. Now, I've been interested in cancer care for a very long time. It was probably the very first medical topic area I tackled, and is to this day probably the one I'm best known for. I'm actually the author of the certification curriculum in hypnotic oncology that the National Guild of Hypnotists offers at its annual convention for consulting hypnotists who want to add that specialization to their practice. I got started with this early. Shortly after I was trained, I did a 2-year postdoc out of Rush Medical Center. I was a parish minister at the time, and I had 9 women in the congregation who had breast cancer. Now, today, our treatment for breast cancer is so much more sophisticated than what it was back then, but they were frightened of the chemotherapy that they would have to take. So they came to me and asked if I would work with them hypnotically to control the side effects of the treatment. Their physicians all agreed, so I did that. There was no literature on how to do this. No one was teaching hypnotic oncology. So I literally made stuff up as I went along. But all 9 of those women did much better than anyone thought that they would do, and their physicians wanted to then send other patients. And within a few years, that completely took over my career and got me pushed in the direction of working with concerns about oncology. Now, it's important to remember that a consulting hypnotist like myself doesn't treat cancer. Only a medical doctor can treat cancer. We work with issues related to cancer, like sleeplessness, worry, sadness, fatigue, nausea, that sort of thing. All the things that make the treatment and the time of cancer treatment and recovery so difficult. Well, here are some things I've noticed in almost 3 decades of work with this constituency. And I direct a program at LaGrange Hospital for cancer patients every week. I do 4 free clinics a month for cancer patients and their caretakers. So I work with up to 100 cancer patients a month in those 4 clinics. So I've got a lot of experience under my belt with this. One of the first things I noticed is that, well, actually, Lawrence LeShan, in his book Cancer as a Turning Point, published originally back in the 70s, points this out. And as soon as I read that book and had some experience with the cancer patient population, I realized, oh, he was absolutely correct. The personality profile he wrote of a typical individual living with cancer, and you can find exceptions, but they tend to be the caretaking, over-functioning members of their family who put other people first and themselves last. That's one of the reasons why cancer care can be a difficult population to work with as a professional hypnotist, because very often the cancer patient feels bad about spending money on themselves when other members of their family might have a need that money should go for. They put themselves last. We call this, and this would be the second major point, a boundary issue. In addition to being kind of codependent and putting themselves last and over caring and over functioning with others, cancer patients tend to have issues with boundaries. They don't know where they leave off and other people begin, so they will inappropriately take on responsibility for the feelings of other people, as an example. Now, it's interesting. I don't want to push this metaphor too hard, but there is exactly one creature in creation that can survive without some boundary between itself and its environment. Even a virus needs a protein shell. But there is one creature that thrives without a boundary, and that creature is the cancer cell. It is by its very nature invasive and transgressional. And so it's kind of interesting that people who are struggling with cancer often have issues with boundaries. And part of the work that I will do with someone in this position is to help them learn to set boundaries with other people, to say no at least some of the time, to put themselves first at least some of the time, um, to not overfunction, to not take responsibility for other people's feelings or behavior. And as they get better at doing that, very often we start to see positive medical consequences as well. Now, one way of thinking about this is the metaphor or story I'm sure a lot of you have heard of the airplane cabin depressurizing and the oxygen masks fall down. You put your own mask on first before you try to help someone else put their mask on. Because if you don't do that, you're both going to pass out. And that's the image. You've got to put yourself first at least some of the time in your own life. And if you're not going to do that, you're not going to be able to help the people you want to help. So that's the message I try to get across to these people when I work with them. If you're not going to be there for yourself, you can't be there for anyone else. Cancer patients who successfully go through their treatment and make a good adaptation to their diagnosis go forward to what we call a new normal. Cancer is a life-changing medical diagnosis. Life is never going to be the same as it was before you got that diagnosis. You cannot go backwards into the future. It's going to be different. The treatment was going to change your body physically, maybe surgically, but chemotherapy adds years to your biological life. So you end up with a body that's, biologically older than your chronological age, because most chemotherapies are powerful oxidants. They age the body. Your energy level will probably never be the same as it was. Fatigue becomes something you just have to learn to live with and cope with. And cancer patients make a good adaptation to this, to value time differently. They're more willing to live in the moment, to set each day up so that there's something fun in it. They try to prioritize themselves and their own enjoyment. And they set goals and they fulfill their obligations, but they keep their eye, at least half an eye, on themselves and their own relative happiness. And they prioritize their own happiness. One consequence of this is very often a person successfully navigating through the cancer experience will reinvent themselves. They become who they want to be instead of who other people want them to be. Sometimes these reinventions can be quite dramatic. I had one woman who actually is now dancing at a club called Heavenly Bodies out by O'Hare. Not what I would have hoped for her, but she obviously had a strong exhibitionistic streak, and she decided to make that real. And she did well with her cancer. One person was an executive. He's now a custom gunsmith. Or the reinventions can be much more modest. Someone who wanted to be a chef becomes a serious home cook. Someone who wanted to be a poet takes a class on poetry, writes poetry, and starts self-publishing through Lulu or CreateSpace or those kinds of presses. Now, cancer is a difficult diagnosis to receive. When you get the diagnosis from your physician, you go into what Milton Erickson called a transderivational search. You turn your attention within, looking for any information you have that helps you deal with what you just heard. Now, when you're doing that, you're actually in a self-hypnotic state. And you'll internalize, as a self-hypnotic suggestion, anything the doctor says next. So if the physician says, well, we think you have 2 years to live, the physician has just given a post-hypnotic suggestion to a hypnotized person to die in a certain timeline. And if you're a hypnotist, there are techniques you can learn to undo that damage. But that kind of medical hexing goes on all the time. And when you've got the diagnosis, you don't know what's going to happen right away. There's a period of time where tests goes forward. This is called staging, where they determine what stage your cancer is at and its degree of aggression and other markers. Then and only then, when all the blanks are filled in, do we know what your treatment's going to be and what your outlook's going to be. During that time, it's a time of intense worry, as you can, I'm sure, imagine. So pretty much everyone who goes through this experience comes out of it pretty much with a case of post-traumatic stress disorder. And even after that is resolved, years in the future, when they're reminded of cancer, they'll get a secondary traumatic stress. They'll see a pink ribbon and it calls them back to that frightening experience. But on the flip side of this, that experience teaches them to be realistic about their lives. First of all, it makes it clear that their life is going to be limited. Even if they have their full normal life expectancy and died something else, none of us get out of this alive. As I often quip, that being alive is a sexually transmitted terminal disease. And cancer patients realize that in a way I think that other people don't. On 9/11, when we had the disaster, the tragedy at the World Trade Centers, we had a whole nation that was in PTSD. It was such a shocking experience to them. But I noticed my cancer patients took it in stride because they already knew that bad things can happen to good people. That wasn't new information for them, and they had come to some internal accommodation to it in how they viewed the world and how they valued time. So those are the things I've observed over the years, and these people, cancer patients, are often individuals of immense valor. Some of the most admirable people I've ever met have made the cancer journey successfully, and it's humbling sometimes to do this work. Well, thank you for paying attention. I will be back next week with a different talk, and I'm going to be talking about one of the other areas of focus in my practice, which is weight control, and it's probably not going to be what you think. I don't do diets and that sort of stuff. So I think you might find it interesting if you tune in. Thank you for being here. As always, if I can be of service to you, please feel free to reach out through my website or Facebook, and have a good day.